Hello, everybody. My name is Kahari Johnson, and I'm the Chief of Staff of Patient Point Foundation. Today, I have the amazing opportunity to have a conversation with one of our amazing community health ambassadors in Columbus, Ohio, Mr. Troy Anthony Harris. What's going on?
Hi, Kahari. I'm feeling good today.
Good, good. I'm glad you're here, man. Glad you're here. So, just want to get right into it, man. So, how did you get involved with Patient Point Foundation, and what led you to want to be a part of the work?
Well, I found out a few years ago as I was working professionally that I really had a passion for improving healthcare, particularly for my community, the Black community, and my LGBT community, because we have a lot of health issues that are pertinent and specific to our communities. And so I really wanted to be a cog in terms of getting information and resources out there. It's about educating people about their health, educating people about their health practices, and helping people get access to information. I went through a rather traumatic medical experience getting prostate cancer back in 2021. And it was a life changing situation for me. Not only was I discovering how much prostate cancer affects us as men of color, but I was recognizing that we don't really kind of have a community that really talks about prostate health and the preventable methods that we can use to kind of prevent needing prostate surgery. Unfortunately for me, I had gotten diagnosed in 2020, and that's when COVID hit. And so I wasn't even able to get care or examination until the end of 2020. And by then, the cancer had metastasized so much that I needed immediate surgery. And that situation alone changed my life. Um, I'm committed now not only to providing health information, but being very specific about getting Black men to talk about prostate health because, we're not taught to talk about such things, but we have to. It's important because prostate cancer, as prevalent as it is also one of the most treatable and preventable forms of cancer. So it is about what we talk about in Patient Point Foundation screening and healthcare. As I was kind of going through my situation in terms of kind of recovering from that and dealing with the fallout, because if the medical thing it affects the job, and if you don't have the job, it affects the home. And so I was really kind of finding that a medical situation can really kind of change your life and drop the floor out. I mean, any of the major illnesses or diseases can really just drop the bottom out of your life. And since then, it's been a matter of trying to figure out what I'm going to be in this next chapter. So during my quest for stability and getting life back on track, I came across the amazing, excuse me, Susan Colbert, who is one of our community health ambassador leaders in the community. And she has assembled this amazing team of people, all of whom are committed to being resources of information to the community.
For sure. Yes, shout out to Susan for sure. She is definitely a pivotal part in everything that's happening out here in Columbus with the community health ambassadors. And so one of the things I wanted to kind of circle back to. So you said you were diagnosed in 2020, didn't get essentially access to care until late 2020 due to COVID. And by the time you did get to that point, it was immediate surgery.
Mhm.
What are some of the things in the healthcare process that worked? And also, what are some of the things that, outside of the obvious things that did not work?
Well, what definitely worked and what made a difference was my provider. I had an amazing prostate surgeon, Dr. Ryan Hedgepeth. Give him a shout out, Dr. Ryan Hedgepeth of Apex Urology. And he took a passionate approach to his care of his patients. I mean, he talked about anything and everything. everything that goes into the effects of prostate surgery, because I actually had to have my prostate removed. And there's a lot that ties into that. Urinary issues, sexual satisfaction. You're not, it completely changes your equipment. I say to some people, um, I've never been a woman, but prostate removal is really akin to what I believe a hysterectomy is. Your guts and insides just being removed, and how different your body is following that. What didn't work for me as well was what goes on with the hormone therapy, because there's a lot of processes by which you got to go through. You can be dealing with radiation, you could be dealing with chemo, but one of the main things that kind of feeds um, uh, prostate cancer is testosterone. And so you've got to go on hormone inhibitors to kind of prevent the production of testosterone. And, I was like fighting with my doctor. I'm like, look, I ain't got that much to begin with. Don't take what little bit I got left. I really kind of noticed being on hormones, how that really changed the body. The hot flashes, the fatigue, the mood swings. I didn't realize how much hormone therapy was really going to just change and affect me, but it did in a major way. And so now I'm really about sharing that story and that experience, which is why I'm so glad to be a community health ambassador with Patient Point Foundation, because this is a real step in alignment with what I want to do in my life, and that's be an information, be accessible to people who want to talk about their health and how to do better around their health.
100%. And these unique experiences, everybody has such a unique experiences, some much more drastic than others. And all these things culminate into exactly why you, for instance, are the quintessential community health ambassador, being able to give that knowledge and also through lived experiences. And something else I wanted to kind of hit on, you mentioned something that is very true. We, especially in our community, we do not like to talk about it,
Right.
whether it be cancer, whether it be diabetes, whether it be hypertension, high blood pressure, all those different things. It's as simple as a headache sometimes.
And sexual health.
And sexual health.
Mm-hmm.
How have you, and how do you plan to continue to have those conversations within the community?
Well, I have a vision. It's about opening up dialogue, and I really want to, you know how connected I am to the African American Male Wellness Walk. I'm really kind of hoping to build a foundation through them. The program I envision is called Let's Talk About the P Word. And I really want honest, genuine, authentic, organic dialogue of us men, Black men, talking to other Black men about our prostate health and not having shame in that. Because there is no shame in talking about what's working and what's not, because you don't know what you don't know.
And we feel so ashamed. Like it's a really weird thing to feel ashamed about not knowing what's right or what's wrong with your body. And once you know what's right or what's wrong with it, having to make those serious steps. I had somebody in my family who recently went through a prostate cancer situation, and they once they went through radiation, didn't have to have a surgery. That now they're in remission, things are better. But that process of literally like from diagnosis to here are the options to taking time because I'm not ready to make the decision, understanding that time is the most expensive currency in that situation.
Indeed.
How was that for you? Like, as far as, I mean, outside of, like I said, the obvious is of not being able to get probably some of the care that you wanted,
Right.
but how was that process of like, you have the conversation, you get the news, what next?
It's a lot to digest. Because there are so many scheduling factors in everything. You have to schedule the surgery, you have to schedule the radiation, you have to schedule the chemo, you have to schedule additional appointments with additional providers, and it can be really overwhelming. It's really easy to say, you know what, I'll do it next year. or I'll do it a little bit later when I have a little bit more time. But time is of the essence when it comes to taking care of cancer, not just prostate cancer, but other types of cancers as well. That early detection is really crucial. And in such a um, disoriented healthcare system that we deal with, um, it's really kind of difficult to navigate. So you're fortunate when you have someone who's really overlooking your care, and I was blessed. I was blessed with a provider because I remember a moment when the oncologist was recommending the hormone therapy, and I was like, no, no, no. And my surgeon came down out of the Bing Cancer Center at Riverside Hospital, confronted me in the street, and said, look, you're going to need this. We want you around for a very long time. And it's going to make a difference that you do this. So his commitment to my good health is what really resonated with me. And so, that's what we want. We want providers who are committed to us and to make sure that we're doing everything necessary.
Yeah. Shout out to him because that's real. You know what I'm saying? Not all the time do you have providers that will do that, that will go above and beyond, that will, advocate for their patients and kind of wrapping everything up and pulling everything together. If you had an opportunity to say, this could get to every single black man in the world, and
Mhm.
you had an opportunity to just give them a message, whether it be pre-screening, post-screening, diagnosis, and actually, what is currently your status?
Well, I have been diagnosed as undetectable. They actually don't use the term cancer-free anymore. They define it as undetectable. But my PSA levels, that's the antigen that actually kind of produces prostate cancer. And don't ask me what the PSA stands for. It's a long, but my PSA is still fluctuating. So there's still some care that needs to be taken care of. But as as far as we've seen thus far, we're not seeing spread of it. So it's just a matter of just trying to control what little bit is there so that there isn't any more spread.
100%. That's awesome. That's awesome. So yeah. So sorry, I got sidetracked. If there was a message that you would be able to give out to every black man in the world right now, facing any sort of health situation, any sort of determinants to health, whatever the situation is, whether it be money, job,
Mhm.
access, all those things, what would you say?
Use every resource possible to you to get that early testing. We have a phrase in the African American male wellness walk: get checked in, not checked out. And that's really kind of the message of that early screening and prevention, because an ounce of prevention is worth a pound of cure. So really staying up to date with your provider, taking advantage if you're having insurance issues, taking advantage of free health services, anything that you can do to get yourself in front of a provider, do it. It's necessary. And you will find that your life is going to be much better if you take those preventable steps.
Perfect words. Perfect words. I really appreciate your time, man. And we'll have many more of these conversations as we continue to go forward.
You're welcome.